not even modestly good control in an interview with Axios. The US has reported 40 million cases of COVID 19 since the outbreak of the virus, with over 4 million infections adding up the US administration earlier this month announced that it is planning to provide booster shots of the Pfizer and Moderna COVID 19 vaccine as the Delta variant has become dominant in the nation and is wreaking havoc. The surge in Delta variant is driven by the low vaccination coverage in many communities across the US, according to the US Centers for Disease Control and Prevention. COVID 19 made the world less peaceful. That's really, in summary, what the humanity is going through with COVID. COVID 19 violent incidents and fatalities January 2020 to April 2021. The violent incidents related to the pandemic peaked in April 2020, as we can see, and the index trend in peacefulness by domain 2008 to 2021, one can see here how in 2020 the ongoing conflict has increased, and instead the safety and security has reduced, and so has multi, militarization has also reduced. But after 2020, if one can see the militarization shows signs of increasing, as we can see where the world is today also. Younger adults are more likely to report symptoms of anxiety and or depressive disorder during the COVID-19 pandemic. The age group 18 to 24, 56% being impacted, 25 to 49, 49% feeling that they experience symptoms of anxiety and or depressive disorder, 39% in the ages 50 to 64, and in the ages 65 plus, it's 29.3%. The average share of adults reporting symptoms of anxiety disorder and or depressive disorder, if we can see a comparison between 2019, that is the pre-COVID-19 period, and 2021, when we are in the COVID-19 pandemic time frame, we can see here the NHIS survey clearly shows 11% was the figure in 2019, the share of adults experiencing symptoms of anxiety disorder and or depressive disorder, whereas in January of 2021, in the household pulse survey, 41% of people, it's almost a 4 times increase in the number of people experiencing anxiety and disorder. The share of adults reporting symptoms of anxiety and or depressive disorder during the COVID-19 pandemic by age. So one can see here a minimum of 30% of people impacted, going all the way almost up to 60%. The American Psychological Association has declared stress in America 2020 to be a national mental health crisis. COVID-19 is a significant stressor for most Americans. Nearly 8 in 10, 78% say the coronavirus pandemic is a significant source of stress in their life. Nearly 7 in 10, 67% say they have experienced increased stress over the course of the pandemic. COVID-19 could exacerbate doctors' existing mental health burden, say further news. As one can see here, the healthcare workers who are the ones who are out there fighting this pandemic literally on the battlefield where they are treating COVID-19 patients, helping them overcome the physical trauma, their families have the emotional trauma. In that process, more than 60,000 US healthcare workers have contracted COVID-19 and 300 have died. And to compare, an estimated 300 to 400 physicians die by suicide every year. And of the health workers who treated patients during this COVID-19 outbreak, 50% showed signs of depression, 45% showed signs of anxiety, according to preliminary research. The self-reported mental health among pregnant women and new mothers. Before COVID-19 pandemic, depression was a new coronavirus strain known as mu, which was first identified in Colombia in January, has been designated a variant of interest by the World Health Organization. After being detected in Colombia, mu, known scientifically as B.1.621, has since been reported in other South American countries and in Europe. The mu variant has a constellation of mutations that indicate potential properties of immune type, of immune escape, the Global Health Body said Tuesday in its weekly pandemic bulletin. And having seen all these various statistics, news about the Delta variant, Alpha variant has impacted everything from economy to people's lives. SPH says the pandemic fatigue setting is a result of continuous lockdown, and it is resulting in delusional ignorance. Holding on to the delusion and supporting the space of delusion decisions leads to delusional arrogance, which is through bhava sankalpa. Continuous lockdown leads to delay forever in this lockdown. going out then and exposing oneself and putting the risk on yourself and others with irresponsibility and sensitivity is a delusional arrogance. The global COVID virus pandemic has left the whole world desperately looking for answers. Life as it had been experienced even back in February 2020 is no longer recognizable. Drastic change is the order of the day, with people having to redefine their world with new paradigms of economy, society, faith, religion, and health. Blessed are those who have had the greatest fortune to be with the incarnation of Paramashiva, the supreme pontiff of Hinduism, in their lives to carry them through this crisis. And now, having taken a glimpse of where the world is in terms of the COVID-19 pandemic and the fact that Kailasa Gurukuls are open for admission, do take the time now to join the COVID Care Protection Center. Register now through the link https://kailasa.org/Kailasa Care. And now let's see where the world is today. Making peace with nature is possible if we start now making peace with nature right now. That is what is the message being given to the world by international organizations like the United Nations. Even amid a pandemic, 2021 can go down as the year which we made peace with nature and set the planet to healing. Our environmental, social, and economic challenges are interlinked. They must be tackled together. For example, we cannot achieve the Sustainable Development Goals, including ending poverty, by 2030 if climate change and ecosystem food and water supplies in the world's poorest countries. We have no choice but to transform our economies and societies by valuing nature and putting its health at the heart of all our decisions. Let us see what making peace with nature is all about. And we saw how the big picture is in terms of health and what the world really needs. The World Health Organization's Health and Peace Initiative. Health and peace are interrelated. In the words of the Director General of the World Health Organization, Dr. Tedros, there cannot be health without peace, and there cannot peace without health. If individuals and groups enjoy equitable access to health services, fulfilling their rights to physical and mental health, and health actors design neutral health interventions that promote trust and dialogue, and communities are empowered to cope with violent conflict, then health coverage is more universal. Grievances can be heard and addressed to generate trust around health emergency concerns. Affected communities are more likely to make meaningful contributions to peace and reconciliation and to resist incitements to violence. Amid COVID, we need enhanced international coordination to build peace. Tackling the pandemic and building resilience in fragile states requires concerted international action at local, national, and global levels. As the humanitarian and economic toll of the COVID-19 pandemic continues to grow, so does the risk that this crisis will fuel new conflicts around the world while stemming prospects for resolving ongoing ones. Stronger health systems and universal health coverage are a must. For the first time since 1940,